Hi, a very good morning, all of you. So, do confirm the streaming quality and the audio will proceed accordingly. Today's live session, as you can see, will focus on hypertension, the initial part, where we'll be discussing certain aspects pertaining to etiology, risk factors, and signs associated with hypertension. And also, we'll discuss regarding how to measure blood pressure, various values pertaining to the standardized values of blood pressure, hypertension, isolated systolic hypertension, and also we'll see what white coat hypertension is all about and which is more accurate comparatively, the clinic measurements or ambulatory measurements. So we'll review all these questions now. And as you can see in the thumbnail, I have posted some questions. And by the end of this session, I'm sure you're going to answer all these questions. Also, I posted some reference material pertaining to today's discussion in our updates group. You can check it out. So we'll be referring Davidson 20th edition. Right? If you have latest edition, you can follow the same. Right? So I hope you guys are ready. So let's give a kickstart to our week with this particular topic. Yeah, all fine. That's wonderful to hear. So as you can see in the thumbnail, I'm not sure if it is visible for you now, but I posted that initially and it will be evident once the video is uploaded completely. So I posted the following questions. What's essential and secondary hypertension? What's the difference? And hypertension is most common in which ethnic groups? And also, does stress cause hypertension? This is something which is very interesting. We think or we take it for granted that persons who have hypertension are obviously subjected to tremendous amounts of stress, but that's not the case as per the literature. So, does stress cause hypertension? We'll look into that as well. And how to measure blood pressure, some important criteria to be kept in mind. And what are various readings, like normal readings, readings in case of hypertension, readings in case of isolated systolic hypertension. And what is white coat hypertension is the one which I mentioned prior, and ambulatory blood pressure measurements versus clinic measurements, which are more accurate in the sense the methodology might be the same, but which closely reflect the patient's blood profile, I mean, the blood pressure profiles. And finally, what are various signs of hypertension? Right. So these are the questions which I was talking about previously. You can also find the material in updates group. So see to that you have having your marker, hard copy or soft copy, whatever, and your notes simultaneously. And also by the end of the session, I'll be posting some homework questions. Okay. Right. So as you can see, etiology. First of all, hypertension, essential or secondary. Majority of the cases, it is primary or essential hypertension where the underlying cause or etiology is not known. It is thought to be multifactorial. Uh, Hence, it is considered to be essential or primary hypertension without any idea on how the underlying mechanism is. But in case of secondary hypertension, there will be almost always some, cause. Like it could be renal issues, or it could be issues with sympathetic systems, or peripheral resistant vessels, etc., which we'll go through in detail. We have a table for the same. You can find that in the updates group as well. And in which ethnic groups it's commonly seen, and also what's the genetic predisposition, what are various risk factors, does consuming alcohol, stress, etc., lead to hypertension, and how do you measure blood pressure? This is something which you're all quite familiar with. You might have seen, you might have done the same during your physiology postings, etc. And most importantly, I wanted to highlight this particular point: ambulatory measurements. To what extent are they accurate compared to clinic measurements, right? So we'll try to have an overview. So in more than 95% of the cases, as you can see, a specific underlying cause of hypertension cannot be found. Such patients are said to have essential hypertension. The pathogenesis of essential hypertension is not clearly understood. Different investigators have proposed kidney, peripheral resistant vessels, sympathetic nervous system as a seat of abnormality. In reality, the problem is probably multifactorial. So, hypertension is more common in some ethnic groups, especially Black Americans and Japanese. and approximately 40 to 60% is explained by genetic factors. Important environmental factors include high salt intake, as you guys are all aware of, heavy consumption of alcohol, obesity, inactive lifestyle, lack of exercise, impaired intrauterine growth, etc. And there is very little evidence that stress causes hypertension, very little evidence. So that's what I wanted to highlight as well. So, in about 5% of unselected cases, hypertension can be shown to be a consequence of a specific disease or abnormality, as you can see in the table. Causes of secondary hypertension: alcohol, obesity, pregnancy, renal disease, endocrine disease, even certain drugs. So, do go through this table, okay? And coming to measurement of blood pressure, see, I want you to thoroughly review this literature because we'll have MCQs discussion as well. Or maybe tomorrow or the next session, I'll definitely plan some MCQs discussion. So do pay keen attention to all the specific details. And coming to measurement of blood pressure, I'm sure you're aware of auscultatory method, palpatory method. So we look into certain specifications like a decision to embark upon antihypertensive therapy effectively commits the patient to lifelong treatment, as you know. So it is vital that the blood pressure readings on which the decision is made are as accurate as possible. You just don't take a reading once, and if it is high, you don't say that the patient is or the person is hypertensive. That's very wrong. So you need to take periodic measurements at least twice in each visit with certain specifications in mind. We'll go through them now. Measurement should be made to the nearest 2 Hg in the sitting position with the arm supported and repeated after 5 minutes rest if the first recording is high. And to avoid spuriously high recordings in obese subjects, the cuff size is very important. It should cover a minimum or at least two-thirds of circumference of arm. Consider this very, very important. If not, the readings will be inaccurate. Okay. Now we'll look into the table. Measurement of blood pressure. You have all the specifications laid down here. So remote type clothing, support the arm at the level of heart, use a cuff of appropriate size of more than covering more than two-thirds of the circumference of arm, lower the mercury slowly and read the BP to the nearest 2 mmHg and take at least two measurements at each visit. Some specifications related to how to record blood pressure, right? Consider this very, very important. And coming to definition of hypertension, when do you say it is hypertension? What should be the systolic measurements and what should be the diastolic measurement? So we have a table representing everything, which is given by British Hypertension Society. So as you can see, in case of normal, we say it's normal when the systolic pressure is less than 120 mmHg and diastolic is less than 80 mmHg, right? I'm sure you're all aware of this. So that you can consider that as optimal. Normal, we do give a range, right? So normal, it is less than 130, systolic and diastolic less than 85. High normal, it is 130 to 139 systolic, 85 to 89 diastolic, as you can see. And hypertension, we have grades: mild, moderate, and severe. You have corresponding values. My advice to you is memorize all these values and consider them important. You can, highlight them, or you can exclusively enter these values in your customized notes. That's worth it. Okay. Now, also we have isolated systolic hypertension where you can see only systolic hypertension being raised. So do make a note of all these points and try to memorize them. Okay. Now, coming to home ambulatory blood pressure recording. So here we'll deal with what white coat hypertension is. So before I proceed, what do you guys think of white coat hypertension? What does it mean? As the name itself indicates, a white coat hypertension. The person who wears white coat has hypertension, or the person who sees another person wearing white coat has hypertension. So what is this? It could be, it could be fear, apprehensive, or some sort of negativity, or whatever it is. The moment a person wearing a white coat checks your blood pressure, you automatically see a spike in blood pressure. I mean, that's evident clearly. Exactly. So white coat hypertension is it's not absolute; it's only apparent. Okay. So exercise, anxiety, discomfort, unfamiliar surroundings can all lead to transient rise in blood pressure. Sphygmomanometry, particularly when performed by a doctor, can cause unrepresentative surge in blood pressure, which has been termed white coat hypertension. And as many as 20%, this is really very interesting because the reason why we're trying to highlight this white coat hypertension is the so called hypertensives, those who had the readings of hypertensive to that of hypertensive patients were apparently having normal values. Around 20% of them were apparently having normal values when their blood pressures were checked at home, right? So, as you can see, as many as 20% of the patients with apparent hypertension in the clinic may have a normal blood pressure when it is recorded either by automated devices used in their own home. So this is really quite interesting. So this clearly demonstrates that there is something called as white coat hypertension. And the risk of cardiovascular disease in these patients is less than the observed in patients with sustained hypertension. A series of automated ambulatory blood pressure measurements. What do you mean by ambulatory blood pressure measurements? When you look into the term ambulatory means to move, on the go. So ambulatory blood BP measurements are BP measurements which are obtained when the patient is on the move, in the sense when the patient is having his normal day-to-day activities. So there will be a cuff and there will be a device which should be attached to the waist, and the person does his activities as usual, like conducting live session, recording videos, conducting tests, whatsoever. So the person's daily activity remains the same, but the blood pressure will be recorded. And studies have shown that this ambulatory blood pressure closely represents the blood pressure profile of that particular patient than the clinic measurements. You can consider white coat hypertension, anxiety, various other factors for this particular reason. So ambulatory blood pressure measurements are considerably more reliable. And also studies have shown that ambulatory blood pressure readings are systematically lower, approximately 12 by 7 mmHg than clinic measurements. This is something which I wanted to highlight, to underline this point. Okay. So, a series of automated ambulatory BP measurements obtained over 24 hours or longer provide a better profile than a limited number of clinic readings. And ambulatory blood pressure readings are systematically lower, about approximately 12 mmHg than clinic measurements. And in the last paragraph, you can see home or ambulatory blood pressure measurements may be particularly helpful in patients with unusually labile blood pressure, those with refractory hypertension, those who may be experiencing symptomatic hypertension, or those in whom white coat hypertension is suspected, right? Now, coming to history, as you can see in the next page, page number 610, a family history, lifestyle risk factors should be recorded. Persons with intake of drugs, even alcohol induced hypertension, are evident, along with certain disorders or diseases such as endocrine diseases, such as pheochromocytoma, coronary heart diseases. So, all of these can be considered as risk factors, right? So, in obtaining history, so close attention has to be paid towards these particular details. And finally, coming to examination. So in examination, you have certain terms. I'll be giving them as your homework. Do find out and get back through mail. So you can see we have various physical signs mentioned in examination. So these physical signs are mostly because of hypertension, as mentioned here. So what are they? Radiofemoral delay, enlarged kidneys in case of polycystic kidney disease, abdominal bruits, Cushing syndrome related signs, central obesity, hyperlipidemia, etc. So, what do you mean by radiofemoral delay? So, as the name itself indicates, there is some delay between the palpations of radio and femoral, radial pulse and femoral pulse. So, what is this all about? Let me give you a hint. In normal instances, radial pulse, femoral pulse are synchronized, they are equal and synchronized. But what is this radiofemoral delay? And also, you can see the term coarctation of aorta. So, what is this all about? So, do find out and get back through mail. And along with that, there are other non specific findings in examination which include left ventricular hypertrophy, apical heave. So, what do you mean by apical heave? Heaving is evident. What do you mean by apical heave? Especially in those with left ventricular hypertrophy, accentuation of aortic component of second heart sound, as well as evidence of fourth heart sound. So Along with that, you can also see it's mentioned that there is optic fundi which are abnormal. We'll discuss target organ damage, blood vessel, central nervous system, retina, hypertensive retinopathy, which is very, very important in the next live session. So we'll stop it here. So do consider the following as your homework. What is radiofemoral delay and what do you mean by apical heaving? So along with that, now let's visit our questions which I posted previously in the thumbnail and you can answer accordingly, right? Yeah. So I hope you guys followed this session. So we'll be knowing the same based on your answers to these questions. So let's start that. So in brief, what is essential hypertension and secondary hypertension? Exactly. So white coat hypertension, apprehensiveness, could be fear, could be negativity. Yeah, essential is. Yes, Ripada, don't worry, even if you don't find questions, because it's in the thumbnail. So it will be posted, or I can do one thing. I can post this in our updates group as well. So we'll do that after the session. Okay. Yeah, we'll do that after the session. So essential hypertension, the cause is unknown. In spite of having so many strides in science and technology, we still don't know exactly the cause, but it could be multifactorial as we discussed, right? Very good. Secondary hypertension, there is some underlying cause. So we have in fact gone through the table where you can find n number of reasons for secondary hypertension. Secondary is secondary to something else, right? So simple to remember. Exactly. So the causes of secondary hypertension are very important. You need to get familiarized with them. Okay. Now, let's suppose you have a question. All of the following are causes of secondary hypertension, except you should be able to make out, right? Now, coming to next question, hypertension is most common in which ethnic groups? Purely memory based, but there is nothing wrong in getting familiarized with these memory based topics as well. So, hypertension is mostly evident in. The problem with this kind of information is that it can be considered biased or it can be considered as, what do you say? Uh, Polarized. The more appropriate word would be disparity, polarized. No. We're coming across very commonly in our country these days. See, the moment you say Black Americans or anti nationals, YouTube is automatically blocking your comments. Unfortunately, given the scenario and situations we are in, given the polarization we are facing, even discussing normal subject matter seems to be a huge challenge. Yeah, I see most of your comments blocked. Okay. Yeah, Anuradha, thank you. Yeah, racism. So, in fact, I was discussing one of the topics a few months ago, and one of the students said the comments were racist. I was really surprised. I was just discussing the information which is given in literature, to which I was accused of. But, anyways, everything went on well because I gave a appropriate clarification. So when most of your typing African Americans or Black Americans, it's being considered as spam, unfortunately. Anyways, it's not racism. So as mentioned in Davidson, hypertension is more common in some certain ethnic groups such as Black Americans and Japanese, as you all rightly mentioned. It's given as African Americans. Okay, African Americans, Black Americans. I think they can be considered as synonyms, right? Yeah, maybe we should evolve into smarter people. As Urvi rightly mentioned, wonderful Urvi, we can use short forms. Good. Yeah. Okay, now, does stress cause hypertension? A simple question. It will be useful for you to discuss with your friends and family as well. Does stress cause hypertension? Does stress cause ulcers? because we have seen in idiopathogenesis of ulcer formation also stress has been mentioned as one of the probable causes. The point is very simple. We exactly don't know the mechanism, but it could be included as one of the risk factors. Very little evidence. So what do you mean by very little evidence? It's almost nil. Yeah, very little evidence. Quote. Very good. So, how to measure blood pressure? You know, the level of the arm should be at the level of the heart, and the cuff has to be placed above the elbow, as you know, in the bicep area. And the cuff size should be such that, see, for you and me, it's not a problem. Again, this is not biased or racist comment, but those who are obese, okay, their circumference of the arm is considerably more. So, at least two-thirds or more than two-thirds of the arm has to be covered in order to obtain appropriate measurements, right? So just keep that in mind, and closest to mmHg has to be recorded. So other criteria you can clearly see in the table mentioned here. Exactly, exactly. Do keep that in mind. And what are various values of normal hypertension? I mean, normal blood pressure, hypertension, and isolated blood pressure. I want you to memorize all these values. Just memorize them, mug up. There are certain things we need to mug up, right? A simple tip which I can give you is rather than, I didn't highlight this as you can see in the pictures which I posted. So if you can copy the table in your notes and spend the next 2 to 3 days early in the morning for at least 10 to 15 minutes consistently for the next 2 to 3 days to memorize these values. You'll remember them till the date of exam, at least till the date of exam, if not lifetime. Take my word. Okay. Yeah, clinical measurements, a minimum of 2 recording. That's another important point. Now, what is white coat hypertension? We discussed in detail, and I'm sure you guys are familiar with it. So, ambulatory blood pressure measurements and clinic measurements. Which one do you think is more reliable or more closely represents patients' blood pressure profile? Ambulatory and clinic measurements. It's very simple. A clinic is only when you visit to a clinic. Two measurements, as Rahil and a few of you mentioned. But ambulatory is on the move. So you have, I mean, you can Google images, or if you want, I can post them in the updates group. We have certain devices which can be placed to your waist and cuffed to your arm, and for 24 hours. For a period of 24 hours, a series of recordings can be made, which closely resembles that of your patient's profile. And you know, as studies have shown that these ambulatory blood pressure measurements are 12 by 7 mmHg lower than clinic measurements, right? Exactly, exactly. Good. So, final question: what are various signs of hypertension? So, in the examination part, we have seen certain physical signs. So, that will be our final question. So, what are various signs of hypertension? Yeah, sweating, you can consider that as a symptom, right? Yeah, uneasiness, these are all symptoms. We're talking about physical signs. The one based on the examination by the operator or the physician. Good. Radiofemoral delay in case of coarctation of aorta. Even in tetralogy of Fallot, if you remember in one of the general medicine videos, we discussed it last year. In tetralogy of Fallot, you find coarctation of aorta as one of the features. I think it's overriding of aorta. So, anyways, do check it out and you can get back through mail. Yeah, hyperlipidemia, obesity, apical heaving, very good. Very good, Arushi. Yeah, enlarged kidneys in case of polycystic kidney disease. It's coactation, not coagulation. It's coactation of aorta. Yeah, moon phases in case of Cushing syndrome. Good. Yeah, renal artery stenosis and also abdominal bruits in case of renal artery stenosis, as Prachi has rightly mentioned. The bruit is a murmur, right? Something which is audible. Fantastic. Yeah, fourth heart sound. Good. So you can make a note of all these important points, right? So I'm sure you're aware of the concept of notes making, and you have any further queries, you can always get back through mail 24 by 7. And also you have your homework questions. Along with those homework questions, do comprehensively note down all the relevant points which we discussed in today's live session, and you can get back through mail for review and analysis. Okay. Yeah, you're most welcome. And before I conclude, actually, I wanted to start this live session with these particular comments, but anyways, it's never too late. In fact, I was going through some of the mails and trying to give you some coming up updates yesterday. So I was working continuously, and by 11:30 or 11 o'clock, I've been working around the clock, and by 11 o'clock, I felt very frustrated. I felt very, very negative, and I didn't knew actually what I had to do in order to overcome that negativity at that particular instance. Then what I've done is I just stopped my work. I stopped everything as it is. I haven't checked my mobile. I stopped checking all the mails after giving all the updates. After the given work is done, I kept everything aside at 11:15 or 11:10 p.m. Indian Standard Time, and all I did was just went outside. I mean, ours is a closed community, so we are allowed to go outside. Like we have our roads, and it's like a street. So I started walking. Luckily, for the past 2 days, as you guys are aware of, I'm not sure if it is raining. It's been raining here. So in fact, it's cloudy to some extent. It's again sunny now, but it's been raining, and the climate was pretty good, comparatively okay. So I started walking. I spent around 30 to 40 minutes just walking, casual walking, and that itself has given me a lot of positive energy. So the point which I'm trying to make is, whenever you feel negative, frustrated, or you're feeling like your thinking is becoming crazy, just stop everything as it is, and get and go away from that particular work. The best thing you can do is don't check your mobile phone. Just go for a walking if possible, or if you're not allowed to step outside your home, at least go onto a terrace. Or if even that's not possible, just close your eyes and just stop whatever you're doing. And that's all is required. That's more than sufficient. Everything will set right, and you will eventually get back to your momentum. You will gain your momentum again, right? But if you continue working, if you continue thinking, if you continue studying, even in those instances, it spirals down, and it will cause a ripple effect and will eventually get you down. So do not allow that to happen. And another important thing which I noticed yesterday is, even though we know the fact that schedule is very important, a rigid schedule always is not productive. Sometimes it is counterproductive. So usually I take a walk in the evening time, 5 p.m. or 6 p.m. Indian Standard Time. But yesterday I haven't because of the workload. So I went for walking at 11:30 or 11:15 p.m. Indian Standard Time. It actually took the pressure off. I mean, doing certain things based on your convenience, based on your time availability, will actually take the stress off. If it's like you have to go to walking at 5 o'clock every day, it will be stressful. Even for that matter, these live sessions, if you think you have to attend every live session at 10:30 or 11 a.m. Indian Standard Time every day, it will be stressful. So my point is, if you're feeling that, or if you're perceiving that as stress, do not attend this session or do not do that particular activity. If you can't walk now, you can walk later. If you can't attend a live session now, you can watch the recorded version a bit later. You're not going to lose anything. With technology, with willpower, you have the ability to do things at your convenience without feeling low. So that's the point which I wanted to highlight. Right? I hope you got my point. So take that stress off, take that pressure off. Don't be under that assumption that you have to always do certain things at certain points of time. It's okay even if it goes to and fro. That's absolutely fine, right? I hope you got my point. And for any further queries or assistance, you can always get back through mail 24 by 7. So wish you all the best. Love you all and have a great week ahead. Don't hope for such week to happen. Rather, make it happen. Let's make it happen. Okay? Love you all.